Good morning, I'm Tina Jennings. Now, this Thursday is Fall Prevention Awareness Day. So the Pima County Health Department is taking the days leading up to this event to really help all of us take the right steps to be safe. Now, they have assembled some of the best people in our community to join us the next 4 days here on The Blend to do that. Starting today with those that would maybe come to our aid if we did experience a fall. Nurse Mary Derby, Golder Ranch Fire Chief Randy Carr, and the Coordinator of Trauma Outreach, Susan Kincaid. Thank you all so much for kicking off the series with us.
Thanks for having us.
Thanks for having us.
Well, let's actually start out. I did say that Thursday is Fall Prevention Awareness Day. What does that mean?
Well, what it is, it's an annual event, and it occurs each year on the first day of fall, and it's used to promote the seriousness of falls for our older adults.
And is that maybe why it's so important to take a day to kind of really focus on this?
Yes, and it's so important that we're all members of the Southern Arizona Fall Prevention Coalition, and we're taking the whole week to educate everyone on the dangers of falls and the real simple strategies that you can take to prevent a fall.
Well, tell us a little bit more about the coalition and what you do beyond just the one day that we're kind of setting aside for awareness.
Well, the coalition is a network of community agencies, and Pima County Health Department is pleased to support the coalition, and also fire departments. And we support the national coalition efforts by providing important education on the risks of falls and, again, strategies to prevent a fall.
That's exactly what we're doing this week. We're taking the time out each day. Like I said, somebody else is going to join us, and we're going to kind of learn along the way things that we can do, get a little bit of education. But Chief, why do you really think partnerships and kind of collaborations like this is so important?
Well, Tina, it's really important because, you know, in our line of work, I mean, we're really the eyes and ears. We're the first responders. We'll get there first. So we see the living conditions and we see what the patient is going through. So it's very important for us to be able to pass that along so we can make sure that we can try to prevent the event. And that's what's so important about the coalition is that we're able to pass that forward and making sure that really we can stop these falls before they happen, because we're very reactive, you know, hence, you know, we're first responders. How cool would it be if we could actually prevent them from falling and help in that educational process? But collaboration with the other agencies is critical to what we do.
I absolutely agree. And you did say you get to see kind of firsthand. Do you see maybe some trends that have come about during maybe some of these calls or things that you're seeing when you have to respond to a fall?
Absolutely. We respond to about 3 a day on average. 2 of those will result in a transportation to an emergency room. So that's about 1,000 a year. And, you know, statistically you see where once people fall, you know, generally they see a health decline. So what we want to do is try to prevent them from falling in the first place and really try to emphasize the need for safety and keep them out of the situations where they would fall.
I always say whenever I have somebody that comes on the show in your line of field, we don't want to see you. You're a great gentleman, but we want to try to do those steps to maybe keep from having to have you guys come to the home, be there for that first responder portion. But again, we're talking about if it does happen and you are a patient of a fall, what do we do as far as like assessment for a patient once they come in?
Yes, when they come into Banner University to our trauma center, all our patients are assessed for a fall risk. And if they are deemed to be a fall risk, they will receive special attention. They get a sign on their door that says fall risk. They have special yellow slippers as well as a yellow band, so staff is extra aware that they may fall again while they're in the hospital, and we definitely don't want that. And once they are in the hospital, there's another process and assessment that they go through, and they have signs that are put on their door that are either red, green, or yellow, which when their call light goes off, the staff knows, you know, at what level, how quickly they need to respond to that patient. We also put fall alarms on the beds, and it's a great teachable moment once they're in the hospital, just educating their patient and their families on ways that they can prevent further falls, because once you've fallen once, you lose a lot of your confidence and then you start, as Chief said, you start declining because you're afraid that it's going to happen again.
And I know you actually have a program that is starting out tomorrow that we can take part in to kind of, like we said, take those steps ahead of time.
Yes, our trauma services is starting a 3-week long lecture series, 1 hour each week, and it's starting tomorrow. And in order to get more information, you can call 694 4713. And to sign up for that, we do ask that you call to sign up so that we know how many people are attending. But we'll have our one of our trauma physicians speaking specifically about geriatrics and how you can prevent yourself from falling. We have a pharmacist talking about how medications increase your risk of falling. And then we also will have a physical therapist talking about some ways that you can keep yourself from falling and exercises you can do to keep yourself strong.
Well, I think that's amazing that this is available for us. Like you said, 3 weeks starting tomorrow. We have our first one. We're going to be taking these 4 days here on the blend, of course, to try to get some more information. I know we'll also be hitting on prescription drugs and things that also can be contributing to that. But even beyond everything we've just said, is there just even more places we can go to get more help and more information?
Go to our website, the Pima County Health Department website, as well as the Pima Council on Aging. Both websites will provide very useful information on community resources that are available to everyone.
I want to thank all three of you, not only for the information that you've given us today, but for all that you guys do to help everyone along the way. So thank you, all three of you.
Thank you, Tina.
Oh, absolutely. To learn more about changes that can be made at home to prevent falls, some medications that lead to falls, and how exercise and activity can help prevent falls, stay tuned in the Morning Blend all this week, or you could also log on to pcoa.org/fall prevention.